Welcome to Chemotherapy and You. This is a class geared to provide information for caregivers and patients undergoing chemotherapy. Objectives: to inform patients and caregivers about chemotherapy and common associated side effects. To provide information about initial interventions and treatment of common chemotherapy side effects that can be performed at home. To provide guidelines for when to contact the office for patients experiencing side effects from chemotherapy. And finally, to provide resources for patients and caregivers who wish to learn more about cancer treatments and their side effects. For today's class, we will be focusing on the neuropathy that may occur with chemotherapy. Remember, this may be mild, moderate, severe, or not occur at all, depending on the amount and type of chemotherapy you receive and how your body reacts. Some types of chemotherapy can cause damage to your nervous system. This can cause numbness, tingling, or pain, most often affecting the hands and/or feet. The term used to describe these symptoms is neuropathy. Other types of neuropathy can cause cold sensations, balance issues, hearing loss, or gastrointestinal difficulties such as constipation or heartburn. Most commonly, neuropathy improves within the first year of stopping chemotherapy. However, there are some chemotherapy drugs that can cause long-term or even lifelong neuropathy. Let your doctor know right away if you notice any nervous system changes. It is important to treat these problems as soon as possible. There are medications available to help with neuropathy that may be uncomfortable, and your chemotherapy dose may need to be adjusted to prevent worsening symptoms. Let your doctor know if you have any pre-existing neuropathy prior to starting your chemotherapy treatment. For example, those due to diabetes, B12 deficiency, or chronic lower back issues. Remember to let your doctor know right away if you notice any nervous system changes, as it is important to treat these symptoms as soon as possible. There are several ways to manage neuropathy. First, be careful handling sharp objects such as knives or scissors. Avoid falls, walk slowly, use handrails, and remove trip hazards such as area rugs or cords. Use a cane or other device to steady yourself when walking if your feet are numb. Wear shoes with rubber soles such as sneakers or tennis shoes, and put no-slip mats in your tub or shower. Use caution when handling hot objects, and use a thermometer to test the temperature of your bath water prior to submerging. It is helpful to wear gloves when working in the garden, cleaning, or washing the dishes. And finally, avoid temperature changes as this may aggravate symptoms. Neuropathy often occurs in the stocking glove distribution, starting at the fingertips and toes, as outlined in dark gray, then slowly progressing to the ankles and wrist, as you see in light gray, then climbing up the arms and legs. It is important to notify your doctor if you have pre-existing neuropathy before you start chemotherapy. Talk to your doctor if symptoms of numbness, tingling, or burning increase or last from treatment to treatment. Tell your doctor if you have difficulty with fine motor skills such as buttons, zippers, typing, or if you have difficulty walking due to the numbness in your feet. And finally, ask your doctor about options for treatment such as medications or physical therapy to help with neuropathy. In conclusion, review the drug-specific printed materials provided to you by your physician carefully. Ask questions, and remember, there is no such thing as a stupid question. Be aware that every patient is actually different. You may experience mild, moderate, severe, or no neuropathy at all. Keep a notebook or journal of any neuropathy that you experience and when they occur. For example, does neuropathy occur a couple days after chemotherapy and resolves quickly, or does it last from treatment to treatment? Bring your journal with you to your visits, as this may help your doctor know how to treat your symptoms. Take advantage of offered support groups, patient programs, and educational offerings. And remember, the physicians and staff here at CCI are here to support you through your cancer treatment. Please do not hesitate to call or ask if you are uncertain about any side effects that you are experiencing. For more information, please see available online resources listed. And thank you for participating in Chemotherapy and You.